remain vigilant. Don't let a return to normal activities be viewed as a return to normal. We'll pause for a minute and we'll let our friends set up. Do you need a minute?
Thank you.
Okay. All right, thanks. Over the weekend, COVID-19 cases across the country reached record levels, higher than they've been in the past 2 months. We're seeing our rural areas the hardest hit. Unfortunately, our rural areas frequently struggle with access to health care and have limited capacity in their hospitals. In St. Louis County, we have 150 cases per day, which unfortunately is too many. More people are getting tested, so this allows us to understand how the virus is moving about in our community, and that's good information to have. With a positivity rate around 4.5%, this has demonstrated that the precautions that we have taken in masking and social distancing are paying off. And as we continue to work together to keep the virus at bay in our community, St. Louis County is working to distribute $173 million in CARES Act grant funds to the people who need them the most. We've awarded $19.2 million to small businesses, and with the St. Louis County Council's help, we've distributed those funds in all 7 county council districts. More than 1,600 households have received rental assistance or mortgage assistance, and this has gone predominantly to the northeast area of St. Louis County. We've awarded $2.6 million to nonprofits for food distribution, and we're extending the food distribution program through the end of the year. And over the past several months, my administration has met with municipal leaders around St. Louis County to discuss with them their needs for a portion of the federal CARES Act funds to support public safety. We are going to support those public safety expenses that are attributed to the response and recovery effort to the public health emergency. Based on input from the Municipal League of St. Louis, we've set aside $47 million to support our 88 incorporated municipalities in St. Louis County on a per capita basis. The Municipal Relief Program will provide municipalities with reimbursement for certain eligible expenses, including public safety and other costs, either incurred or anticipated during their response to this crisis. Additionally, our administration has allocated millions of CARES Act funds to public health and humanitarian relief, including the food distribution and rental assistance programs that we previously mentioned. And we believe this per capita plus program is built on an equitable framework. We anticipate by the end of this week that money will begin flowing to the municipalities that have a completed application with St. Louis County. Meanwhile, we've extended until 5 p.m. Tuesday the deadline to apply for this program. Previously, the deadline had been last Friday. We want to make sure that every municipality in St. Louis County has the opportunity to participate in this program. Tomorrow at 1 p.m., we will have a webinar that goes through the process of applying for this program, and more information about that webinar is available on our website at stlcorona.com. And finally, I'd like to remind everyone that we have drive-through flu shots and drive-through COVID testing available again this week. On Tuesday from 8 a.m. till noon, we'll have drive-through flu shot and COVID testing available at the St. Louis County Library's Natural Bridge branch, and that is at 7606 Natural Bridge Road. And on Thursday from 8 a.m. to noon, we'll have drive-through flu shots and COVID testing available at the Jamestown Bluff Library Branch. And that is at 4153 North Highway 67. Getting a flu shot decreases your chances of getting the flu, which decreases the chances of being hospitalized and stressing the capacity of our hospitals. We must do everything we can to make sure that we have capacity for COVID-19 patients in our hospitals as we approach our winter months. The CDC recommends that everyone over 6 months of age get a flu shot unless you have a medical reason not to. Thank you, and I would be glad to answer any questions.
Are we still seeing a lot of people, you mentioned last week, from more of the rural counties coming into St. Louis County to be hospitalized? Is that a trend that we're still kind of seeing?
That's a trend we're seeing, and I expect that trend will track along with the cases that are being reported from the more rural areas of Missouri and the surrounding counties.
Can you give me an example of some of the costs that a municipality could potentially be reimbursed for? What kinds of things?
Well, predominantly it's their public safety costs, but if municipalities have other costs that can be attributed to response to COVID-19, anything to do with recovery efforts, services they provided to their communities that are directly related to COVID-19, then those costs would be eligible.
When you say public safety, is that like PPE or what?
Well, the PPE is reimbursed, could be eligible for CARES Act, but it's also eligible through FEMA and another federal program. So we're encouraging folks to first apply to FEMA and allow St. Louis County to participate in the cost share piece of that. We're going to do everything we can to keep the cost to municipal government as low as possible, especially in the presence of declining sales tax revenues that we're all aware of.
This was our first weekend with high school football.
Yeah.
All in all, how did it go?
Well, I haven't heard of any concerns. I don't always hear of them at the time. Some of these things take time to develop. We wish everyone the best and hope that everyone will follow the safety plans that they've turned into our county public health department, which includes cooperating with isolation and contact tracing should anyone become positive who's involved in any sort of youth sports. Other questions, Doug? No?
Yeah, have several other school districts joined in with submitting in plans? If so, what is the update on those? I know at last time we visited, there were 5 approved and 10 under review.
Last I heard, there were at least a dozen or so that have submitted safety plans for high school sports that include, isolation and contact tracing plans on how they'll manage activities around sports and how they'll manage spectators around the sports. Those are the most important elements. But they've been working on those plans for weeks, so I think most of them were ready to go. And I know the Public Health Department spent a lot of time last week reviewing those. We want to make sure we keep everyone safe.
You had a lot of inquiries or any kind of conversations as it relates to your recommendation about in-person high school resuming?
Well, there is a lot of folks that are have concerns, and there are a lot of people that are anxious to get back to an in-person learning setting. And I'm happy to see that it remains optional throughout most. I think the school districts are working with parents to make sure that their unique situations are addressed as best as possible. And some parents and students are comfortable in a virtual setting, and others are more anxious to be back to an in-person setting. And we just want to make sure it's safe. So our public health department has been working very closely with the superintendents to make sure that their plans are going to work and that they have good isolation and contact and quarantine procedures in place when they're needed.
Dr. Pesh, do you have any updates or information on the cluster of
Yeah, I believe we have, I believe there's 19 positive cases. 2 of them were symptomatic, 1 inmate and 1 corrections officer. Over half of the inmates in the jail and employees have been tested, and we'll work through the other half in the next day or 2. And the ones who are positive are kept away from other inmates until they can recover. But so far, everyone is recovering. We've tested most of the folks in the jail, and we'll continue through the rest of them in the next day or 2. We've had a response plan ready for a long time, and we were lucky over the past 7 months. We've had very little COVID-19 infections in the jail, but we've initiated a lot of precautions from the beginning. We have very strong procedures in place, and we've had a plan to implement should inmates become positive, and we're implementing that plan now. Okay, thank you.